Hey there, and welcome to this explainer. So, when you hear the phrase healthcare sustainability, what's the very first thing that pops into your head? For most of us, it's environmental waste, right? We picture overflowing bins of medical supplies, single-use plastics, or, biohazardous materials. And while managing medical waste is absolutely crucial, focusing only on the trash bin kind of causes us to miss the massive, unseen systemic risks that actually keep a hospital running, or in the worst cases, force its doors to close. Today, we're looking at the SASB standards for healthcare delivery, and we're specifically focusing on these hidden pillars of human capital and systemic risk.
So let me ask you this. What is the biggest hidden threat to your local hospital right now? It's a pretty provocative question, isn't it? You might immediately think about funding or maybe complicated new regulations. But actually, according to the sustainability accounting standards used by global investors, the true existential threats to healthcare delivery are grounded in two main things: human capital and macro environmental risks. Basically, if a facility cannot keep its workers safe, if it can't retain its specialized talent, or if it's completely unprepared for extreme weather events, well, that facility is fundamentally unsustainable. Okay, let's dive right into this. Today, we're auditing three vital signs. 1. Keeping healthcare workers safe. 2. The healthcare talent pipeline. And 3. Climate impacts on healthcare.
First up, Section 1, keeping healthcare workers safe, tracking the physical toll of care. The healthcare delivery industry is heavily dependent on a physical workforce, and these folks are routinely exposed to injury, illness, and infection every single day. In fact, relative to other industries, healthcare actually has one of the highest rates of workplace injury and illness out there. Because of this, effectively managing worker health isn't just a nice-to-have. It directly impacts workers' compensation costs, productivity, morale, and ultimately employee retention. To measure this physical toll, the industry relies on a very specific metric called the Total Recordable Incident Rate, or TIIR. Now, a recordable incident isn't just a minor scrape. We're talking about serious work-related events that result in death, days away from work, restricted work, job transfer, or medical treatment that goes way beyond basic first aid. It even includes significant injuries or illnesses diagnosed by a licensed healthcare professional, even if they don't result in immediate time off. Tracking this gives a facility a stark, crystal-clear picture of exactly how dangerous their work environment is on a daily basis.
Now, you might be wondering how they actually calculate that rate. The baseline number here is 200,000. When hospitals report their incident rates, they multiply their total incidents by 200,000 and then divide that by the total number of hours worked by all employees. Why? Well, because 200,000 represents the total number of hours that 100 full-time workers working 40 hours a week for 50 weeks a year would provide annually. It's basically an accounting baseline. It standardizes the data so you can compare the safety of a massive urban research hospital directly against a tiny rural clinic.
But here's the catch. For this safety data to actually mean something, it has to be comprehensive. The SASB standards mandate that facilities calculate this rate for two distinct groups: direct employees and contract employees. Direct employees are the individuals officially on the payroll, full-time, part-time, seasonal, you name it. But contract employees are the independent contractors, the temp agency staff, and those travel nurses who might not be on the payroll but are absolutely still supervised by the facility. True operational health means ensuring safety for everyone operating inside the building, not just the direct hires.
Moving right along to Section 2, the healthcare talent pipeline, navigating the worker shortage.
Beyond physical safety, hospitals face intense competition and severe talent shortages. Healthcare delivery entities are dealing with intensely increased competition for physicians and nurses, driven by soaring patient demand and intensified by current and future talent shortages. Simply put, the ability to recruit, develop, and retain healthcare practitioners is a systemic risk. If a hospital can't keep its staff, it literally can't treat its patients. To diagnose the health of their talent pipeline, hospitals have to rigorously track their turnover rates, but they split it into two very different categories. On one side, we have voluntary turnover. These are employee-initiated separations. Think resignations due to severe burnout, leaving for better pay, or retirement. On the other side is involuntary turnover. These are entity-initiated separations, like dismissals, downsizing, or redundancies. By separating these two, a hospital can tell investors if they're actively losing their workforce to competitor hospitals due to poor working conditions, or if they're just, restructuring their business.
And they get really specific with this. The standard uses strict classifications from the International Labor Organization to break down the workforce. They don't just look at turnover as one giant number. They track physicians, like your specialists and primary care doctors, completely separately from non-physician practitioners, which includes your vital nurse practitioners and physician assistants. And then everyone else, like administrative and support staff, well, they go into a third bucket.
This incredibly granular tracking allows facilities to see exactly where the leaks in their talent pipeline are happening. Are they losing their specialized surgeons, or are they struggling to keep frontline nursing staff? To combat these shortages, healthcare facilities are deploying a massive array of strategies that go way, way beyond a simple salary bump. We're talking about implementing flexible scheduling to fight burnout, dedicated leadership development, comprehensive loan repayment programs, deep mental and physical health support, mentorship programs, offering those highly coveted no-call positions, and even expanding part-time employment options. The sheer volume of these efforts brilliantly illustrates just how hard hospitals have to fight to keep essential medical staff on the floor and functioning at their best.
Let's move to Section 3 and see how this builds. Climate impacts on healthcare, macro-level threats to health and infrastructure.
Okay, so we've covered the workforce inside the building. Now we need to zoom out and look at the macro-level threats pressing in from the outside. Climate change is introducing massive operational variables that hospitals just can no longer ignore. An increase in extreme weather events presents direct physical threats to healthcare infrastructure and creates unprecedented challenges in serving affected populations. The immediate physical stakes are incredibly high. The SASB standards actually require entities to address physical risks to their infrastructure. I mean, imagine a hospital located in a low-lying, flood-prone, or hurricane-prone area. Now think about facility design vulnerabilities. For decades, hospitals routinely placed heavy, super expensive medical equipment, like MRI machines or backup generators, right in their basements. During an extreme flood, that critical infrastructure is the very first thing to be destroyed. Ensuring the availability of backup power during intense, prolonged extreme weather is quite literally a matter of life and death for patients on ventilators or in intensive care.
But it isn't just about protecting the building itself. It's about treating a rapidly changing patient population. Climate change is actively shifting the morbidity and mortality rates of various illnesses. Hospitals must now prepare for completely shifting disease profiles. Because of climate change, vector-borne diseases like malaria and dengue fever, which historically affected tropical populations, well, they might start targeting non-tropical regions. We're seeing heat-related diseases like severe asthma triggered by increases in ground-level ozone. We're seeing waterborne diseases like cholera spiking after increased flooding, and even human developmental disorders like malnutrition stemming from decreased food availability. Hospitals have to somehow find the expertise to identify and treat diseases they've historically never had to deal with.
So what does this all mean? Well, the SASB standards, which are now maintained by the International Sustainability Standards Board, have formalized these exact metrics. Tracking emergency preparedness and response for severe climate events is no longer just some theoretical exercise for hospital administrators. It is a formalized, standardized financial disclosure. Investors and stakeholders actively look at this data to judge a healthcare facility's long-term resilience. If a hospital hasn't documented its strategy for extreme weather or shifting disease profiles, it is considered fundamentally at risk.
So, let's tie these three hidden pillars together. The long-term survival of a healthcare facility doesn't just depend on the number of beds it has or how many surgical procedures it performs. It depends on these three vital signs. Step 1, can they protect their workers from the high physical toll of the job, measured by their TIIR? Step 2, can they retain top-tier medical talent and stop the bleeding of voluntary turnover? And Step 3, are they physically and medically prepared for the escalating impacts of climate change? An institution's ability to measure and manage these specific factors is its ultimate vital sign for sustainability.
Which leaves us with one final, deeply personal question to consider. Is your healthcare provider healthy enough to take care of you? The next time you walk into a clinic or a hospital, look past the medical equipment. Look past the waiting room. Think about the hidden operational realities keeping that building running, the safety of the nurses, the retention of the doctors, and the resilience of the walls themselves against a changing world. That is what true healthcare sustainability looks like. Thanks for joining me on this explainer, and I really hope this gave you a whole new lens through which to view our healthcare system.